What's going on? What's going on Facebook? Just sitting here waiting for us to go live. Urban Renal Talk with Tamika and Steve. We'll be going live in approximately 6 minutes. So we have 6 minutes before the show starts. If you're watching, let me see. Uh, all right, guys. Uh, do, 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 do. Stand by. going on? What's going? Here we go. You haven't missed it yet. Hey, what's going on, Tamika? I got doing a YouTube live as well. You talk with your guest. Oh, okay. That's why. Hey, what's going on? What's going on, kidney girl? 91. Thanks for joining in. I appreciate that. On our Urban Health Outreach Media YouTube channel. You can't see my partner, Tamika Moore. She's on the computer. There she go right there. Yeah, yeah. So we're just waiting for our guests to join the show. You think we may have to do an education moment? Right. Oh, Leslie. That okay. I forgot that was you got. Oh, that's on YouTube. That's your handle. Okay. Oh, yeah, Leslie, that's your handle on YouTube. I'm sorry. You do? Yeah, I got the same artist that does the art for us off of Fiverr. Yeah. So look, next Wednesday, I'm gonna give you the number. I want you to call in to the show. It's at 10 in the morning. Yeah. I mean, they had to open it and they couldn't. I mean, it was like if I didn't get it, then somebody else could come and snatch that time slot. And it was right, it's right after Larry Young Morning Show, who is been there for like 20 some more years. He got a big following. He like the kingpin of AM radio in Baltimore. So try to capture his audience. And he got kidney disease and diabetes. He's not on dialysis though. Yep. Yep. Yeah. I'm supposed to be on, hopefully be on his show so we can talk about leading up to my show. Yeah. Yeah. Anyone can call. He's getting ready to come on. Yeah, anybody can call. Leslie. Oh, he haven't hit you back. So what you want to talk about? Right, hold on. All right, let me go get something right quick. Hold on. You want to? We still got like 5 minutes. Hold on. All right. We're going to start this thing off right. All right, you ready? We're going to talk about we're going to like talk about conservative therapy, palliative and hospice care, and then touch on hepatitis C, transplant kidneys. So I've been seeing a lot of people starting to get what's the word, like frustrated, and, about wanting to give up and stuff like that. So I don't think people really heard about the conservative therapy. Uh, right, 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 exactly. Then we're going to touch in on a little bit of palliative and hospice care, um, because it's getting so many people on it. I mean, these are all modalities that people got to know about. I mean, as bad as it is, and then the transplant shortcut, effective organs. Yeah, yeah, right. But what if the person can't afford the medication? Yeah, that's what we got to talk about. All right, ready? All right. Let me take this off. All right, let's go. I'll let you start it off. All right, guys. Thanks, Leslie, for watching. I appreciate you. Share the YouTube channel as well. We got 40 subscribers. We got to increase that. I know. I'm just saying. All right, let's go. I know. Come on. Let's go. Here we go. 4, 3, 2, 1. We on. Welcome to Urban Renal Talk with Tamika and Steve. Thanks everyone for joining us. What's going on, Tamika? Hey, how are you? Pretty good. How about yourself? I'm well. Yeah, I know you're a little, perturbed about our guest not showing up. Yeah, well, hopefully there was an issue with him trying to get one. Oh, absolutely. Can you? I mean, no, you're right. But let's share a little bit about the guest and let the people know our guest who was going to come on. Well, the guest was a kid. Guess he was a dialysis patient, and we went to touch. Okay, did he get a transplant? I'm not sure. That's why we went to hear his story. Wow, wow. I had an interview on Sunday Morning Transplant Coffee Talk last week with Kendra Tenner, and she was on dialysis and had a transplant and she is now a dialysis technician. I mean, she loves it. She loves it, and she sees, she sees the difference, and just trying to make a difference. But she definitely see, a lot that she didn't know before as a patient. Right, and you know what? I believe that she will. I believe she will make a difference because she's been here before. Yeah. She has more empathy, with them, where she can relate to them better than someone else. Absolutely, absolutely. So Tamika, I know since our guest, we hadn't heard back on the spot. So guys, we decided to talk about a different type of modality, actually two that a lot of people don't talk about. And the only time you may hear about these two different modalities, one if right before someone wants to go on or come off dialysis called conservative therapy. That's one modality, and another one is palliative and hospice care. You have kidney warriors who say they want to stop and don't want to do it no more, and that's their right. And as much as no one wants to see someone do that, but if a person is tired, Tamika, of going through, a chronic condition and they are sound mind, I mean, they have that right. If they didn't, they wouldn't have these alternative modalities for one to seek out.
Right. So true. And you know what? It's needed. Those options are needed.
I agree with you. I agree. So let's just talk about conservative therapy. Uh, and it says the decision is yours. It starts out by saying the decision to do dialysis is personal. And we can't forget that. You know how a lot of people went in the hospital, Tamika, and they get the doctor come in the room and tell them that your kidneys fail, you got to go on dialysis or you'll die. I mean, that really doesn't give a person much time to think about what type of therapy to choose from or modality. In fact, they don't know. The only one they do know, probably the majority, I ain't gonna say all because you never know, but the majority of people who get diagnosed at that moment are not thinking of any other type of modality or treatment other than hemodialysis. Would you agree with that?
You know, that's all they're thinking of.
Mm-hmm.
Actually, it's not. See, the only reason why they're only thinking of that is because that's all they're being told.
Right.
They're not being told that there's other options.
Yeah. And Leslie on YouTube mentioned she had a kidney transplant for 26 years. And after it, huh?
Would Leslie like to come on the show?
Leslie, you want to come on the show right now and talk about your journey? You're more than welcome. All I have to do is send you the link. You just send me your cell number through Messenger, and I send you the link, and you can come on. So just let me know if you would like to. I'm looking at. Oh, she can't. Yeah, yeah. Oh, that's okay. Well, thanks anyway. But the decision to do so, she said after 26 years, she wasn't going back on dialysis again. I guess far as hemo, because I believe you do peritoneal. Oh, she said not now, and she thanked us. But the decision to do dialysis is personal. Dialysis and transplant are life-saving treatment options. They may extend life. They may reduce symptoms of kidney failure. For many people, they may even improve the quality of their life. But not all of us have the same goals when it comes to treating our illness. Some of us choose not to start dialysis. Some of us choose to start dialysis and then stop. And then they go on to say, why would we do this? And then they say there are many possible reasons to me, because some of us sense the end of our road coming. We may not see us. Go ahead.
But it's just tired.
Yeah, yeah. We may not see our symptoms improving. There may be too much pain or suffering. The burden of dialysis treatment may be overwhelming. There may be spiritual reasons. There might just be the hope to spend our time left with loved ones instead of a dialysis chair. What do you think about that? I mean, I see in a lot of the groups where you had caregivers say that their husbands are ready to give up, Tamika.
Right, because I honestly speaking, we don't know exactly what someone really goes through when they're on dialysis. It's not just physically, it's mentally.
Mm-hmm. Mm-hmm. Oh, absolutely.
So they feel like their body is just tired and they just can't take it no more. They can't take the constant one patient The needles just do something to him.
Yeah, I'm sure it's really rough.
And he said when he sees those needles coming, it just takes him to just another place.
Who is this?
When the patient,
Have they ever decided to do home dialysis or peritoneal?
no, no, he's
Right.
new. And he just said every time he sees the needles, it just does something to him. It just takes him.
Yeah, and Leslie says here on YouTube that her doctor convinced her to try it again, that it was different now than it was in '89, the first time she did it, because she said she wasn't going to go back on dialysis. She had given up. And I mean, and that's rightfully understandable. Hey, Lisa Baxter joined the show. Thanks for tuning in, Lisa. If you want to join the show, Lisa, and talk about your experience, you want to come on?
I think conservative management or conservative therapy should be talked about more,
Exactly.
especially with the 70 and 80-year-old, people coming on to dialysis. They are suffering.
Yeah. Lisa, I'm going to send you the link if you want to step on and talk about conservative therapy from patient perspective and social worker. All right, I'm sending it now. I just sent you the link, Lisa. If you want to come on, you can chime in. Ladies and gentlemen, we hopefully get Lisa Baxter, the Lisa Baxter show on. But yeah, Tamika, have you ever met anybody who decided to stop this for spiritual reasons?
Yes.
Really?
Yeah. And they lasted a while. It's just when they came in, the skin color was different. They had more weight on them. That's all fluid. But she stopped it for a while, for like a year. And she only did like 2 days a week, but she eventually stopped it, but then she had to come back.
Yeah, I know somebody that they let do that, but it was in the nursing home.
Mhm.
It was in a nursing home setting.
Yeah.
So,
And I guess the toxins was doing something to her skin. She just looked different. She was a fair skinned young lady. And when she came back, she was darker. She was a lot darker.
wow, because of the toxins.
The toxins.
Yeah,
I used to be light skinned, and I'm like, that's the toxins. You're not don't be quote unquote feeding or using a bathroom or avoiding. Your body is not excreting the toxins.
right, right. Wow. Let me see. And then you got people who just too much pain. I mean, not even pain medication can. Yeah, I can't imagine taking pain meds every day for your pain, and then you're kind of like out of it most of the time.
Mm-hmm. That means they trip. They really don't have a car or a quality of life. They're pain meds all the time. There's no quality of life for pain meds.
I'm sure. I'm sure.
Your life. Because once you come from that high, you gotta go back on it so you can function. But you only can function at a certain percent.
I
And then
know.
when you can't get your high, you're miserable. So you're making everyone else around you. So then that's another issue.
Yeah,
So
it's a
that's
lot of
the
issues that
toxic lifestyle.
exactly. And then they're going to say, whatever the reason, we all have the right to choose treatment. We do. We all have that right, whatever it comes down to. Um, Even in some of these groups, if someone say, I want to turn down a kidney, I'm sure that some people would bash them.
Mm-hmm.
Like,
You don't know their story. Excuse me. You don't know their story to bash them. You don't know what that person is going through, what that person has been through. Why they say, no, I'm not taking that kidney.
mm-hmm,
Because
mm-hmm.
sometimes taking that kidney is not the best thing for you. You go to work out with that new kidney, and you get the whole time of dialysis.
Yeah, I know. I've seen that. I've seen that. And in fact, I had a guest last week, Roxy Johnson, on Sunday morning transplant coffee talk Tamika. She's on dialysis down in Beaufort, North Carolina. She's been on 2 decades. She doesn't look like it. And she said that she rather spend her time out on dialysis. Yeah, yeah. She said she has it down pat. She does home dialysis. Okay. Yeah, yeah. She said she does just fine with that. So, ladies and gentlemen, we're gonna bring on Lisa Baxter, the Lisa Baxter Show. Hey, Lisa.
Hi guys, I'm sorry. I just came in from an MRI and it gave me some medicine. So I'm half asleep and half putting myself together. But I was listening and looking at the show and I was disturbed by hearing, somebody not wanting to go back to dialysis. So that was something that woke me up. So it was like coffee, I guess. I don't know.
Mm-hmm. Yeah, we was talking about conservative therapy, and we're going to touch on to palliative and hospice care. Now, by you being a social worker and up in New York City, which is more than 8 million people, I'm during your time working as a social worker or just being a dialysis patient, have you encountered any other fellow warriors that decided to go into hospice or do conservative therapy rather than move on with dialysis treatment?
Well, I had pleaded with a pastor one time. I went over to his church. I talked to his family. I talked to his flock. And he was determined that what I said or did, that he would not go back to dialysis, or he wouldn't even try dialysis. I getting them mixed up with one of
Talking with
them tried
Lisa
it
Baxter,
and
the
wouldn't
Lisa
come back, and
Baxter
then the other
Show.
one,
Hope
he
you
didn't
can
even
hear
want to
it.
give it a chance or try it. He wanted to go peacefully, and I told him that's an agonizing death. There's no
Share
death that
this
happens
so we can
like
get more
where you
subscribers.
just drop dead. It can be
My partner don't
the
want me to
poisonous
keep
bacteria
asking
in
for
your body.
subscribers.
You know what I mean? You get throwing up, you get getting sick. It's just not an easy death. It's just not that quick. You know what I mean?
Right.
I think that's what they think. It's easy death is going to happen to them. But no, it's not. It doesn't happen like overnight.
Yeah, but they have medicine that they could give someone to make them comfortable.
Oh yeah.
So I'm sorry, what you gonna say, Lisa?
Yeah, I mean, he was headstrong about it. He was an older gentleman. Sometimes they think there's no help when they're older. They just think, sometimes it's a faith thing, or they just think that this is the way God wanted to go, or, I love the Lord, and, he didn't take me that way where I could go, even though I've been through some stuff that, you would think that, or maybe want that, or wish that. When you know what he really wants you, you'll do what you're supposed to do. I know with the other person, I spoke with our whole family. I went over our house millions of times, and she was determined she was not going to do dialysis. She would agree to it 5 minutes, and next minute she would change her mind, and the whole family would call me, and I would go over there, and we would have a powwow with her, show her love. But one family member was stubborn. It was her son that kept saying, you know what they're going to do to you, this and that. So even if the rest of the children and I were talking and going, next thing you know, she wouldn't want to go. And that went on maybe for months. And then she actually passed away. She was up in age, but she passed away. But from what he said, she really believed exactly what her son said. And he didn't have all the facts. And the family got angry with him and everything. And I tried everything talking to him. You do lose some and you gain some when you tell them your story, or when you tell them what to expect when they don't go. Because they think, oh, I'm just gonna, fall out one day or pass out as an easy pasture. And I'm like, no.
Well, let me just put a comment up. Don P. Edwards of CKD New York Champs says maybe she was at says maybe she Right. Well, she said maybe she was at peace with herself and the Lord.
Amen.
Mm-hmm. So I
Some
just
people do get a peace. I won't argue the peace thing. You know what I mean? A lot of people say, "Well, I'm not going to do it." I don't have to do it. God said I don't have to do it, and I said, "Well, there's a lot of saints that know God and believe God, and I didn't hear him tell none of us that. At least I know he ain't tell me that personally. I know he ain't said it.
right,
If that was that easy, I probably just would with my husband or my sister. So
right,
I don't know that easy transition, but sometimes God deal with people in groups. Sometimes He deal with them individually. I've never seen them say kill yourself though,
right.
or torture yourself. So right.
So let me just go on what they say about conservative therapy. They say conservative therapy centers around the decision to not do dialysis. This might mean never starting dialysis. This might mean starting dialysis and then choosing to stop. But that's not all. With conservative therapy, your doctors will focus on keeping you comfortable. They'll use therapies to keep you as healthy as possible during your remaining life. Remember, stopping dialysis does not mean your doctor stopped caring for you or about you. Your doctors will work with you and your family to provide you the support you will need during this time. And then they go on to say what happens without dialysis, which we all know, but the way how they state it, it says without dialysis, many people will pass away within a few weeks. I mean, we know everybody's different, right, Tamika? Some people last longer than that. And then it says, however, this time frame could be very different depending on factors, including if you still make urine or not, all medical conditions, and fluid control and diet. And so you can even do that before dialysis. Like say if your GFR may be 10% and the doctor wants you to start, but if you know about conservative therapy, then you may, and you're not having any symptoms and you still urinating, you know what I'm saying, Tamika? Because you got people who got GFRs like 11, 12% that's not even on dialysis yet.
Fasting, the alkaline diet, the soul.
Right. But the point is, Lisa, like this information so people can make that type of decision is not getting out there. It's like they go to the doctors and they may get diagnosed and they keep coming back, and instead of trying to give them some alternative ways to, halt the progression, they don't. And a lot of people pretty much maybe if they online, they go to the groups, right, Tamika? Like these groups, and they get ideas. And there's there was one group. There's a one group that Stephanie Jenkins. I can't think of the name of it. It's a kidney group, and all they talk about is healthy eating and staying off of dialysis, and they have kidney disease.
Wow.
And they got people who show their labs and how they reduce their numbers. Yeah,
That stuff can be dangerous. You need balance with this thing.
that's the thing.
More people was educating them about changing their diet prior to illness.
Exactly,
So that way
Tamika.
they could be on the machine.
Exactly. And I think for some people, they may start them too late.
Right.
I mean, too early. I'm sorry.
What you put on your skin too, like what you put on your body goes in your body. Yeah, it absorbs. It absorbs. So you gotta watch it that way too.
Yeah. Yeah. Even like with that deodorant.
Yes.
So then they go on to say, Tamika, after you stop dialysis, doctors can prescribe medications and treatments to make you comfortable. In the end, toxins and fluids will build up. They'll become too much for your body and you'll pass away. Uh, yeah, and then they go on to say reducing pain and symptoms. If you choose conservative therapy, it's very important to get all the care you need to be as comfortable as possible. As you begin to think about stopping dialysis, you may want to also consider other treatment options. Pain management, palliative care, or hospice care may make your symptoms more manageable. Medications may be used to keep your fluids and swelling down. If you are in pain or distress, talk to your doctor. They may help you live remaining days as comfortably as possible. So, when you start getting to the point of fluid overload, I guess they administer oxygen therapy, and try to do maybe some type of breathing treatments. But I mean, what can you do when you have fluid in your lungs and you feel like you're going to die? And Tamika, let me tell you something. We had a person go on hospice, right? And soon as they, oh, your guest just popped up.
Oh, okay. So if your guest is there, much love and peace. Thank you.
Okay. All right, Lisa. Thanks for. Thanks, Lisa. You want to stay on? You want to stay on and hear the discussion?
I mean, I don't mind.
Okay.
I don't want to bother with your guest.
Nah.
Have that spotlight.
He is going to have the spotlight. All right, we're going to bring him up. Ladies and gentlemen, Alvin Myers. Hey, Alvin, how you doing? Pretty good, pretty good. Yeah, we have, I'm Steve Belcher with Urban Health Outreach Media. And of course, Tamika Moore and Lisa Baxter, who's with the Lisa Baxter Show. Also transplant warrior, been on dialysis 12 years, had a transplant. So she joined us as well. So tell us a little bit about yourself, Alvin, and your story.
37 years old, and was on dialysis. I got on dialysis at age 35. I was working in the plant, got in contact on top of blood pressure. I was on the hospital kidney function was at 8. So when I went in, they kept me in the hospital for 3 days. On dialysis. I mean, I was being tracked and everything. And 2016, I got sick from that because I got off my machine. I'm in Arizona.
Hey, can you tilt your phone up just a little bit? Right there, right there.
Right there?
Yeah. Okay. Oh, Urban Health Outreach Media.
Yes.
Urban Health.
But yeah, we're doing that time. I got off the machine and I went help people and I got wet. So I ended up having to get the catheter put in my knee. Also, I got the catheter. I went into the other center and I got a chance on that side first, and they said, "You're young. You're too young to be in." Well, at that time, my mom had got herself worked up. Had a kid. So when my mom did that kid, I went over there, and I fell in love with it. I lost a friend during that time. And, I tried to help him out because he ended up having ball analysis too. And
Oh my God.
Say, yo, they put a catheter in him. This is when I told the family to I was in now, but I went over there for 4 hours a day before. So when he went to the hospital, they pulled too hard and he ended up in the office. So I went into a lot of different stuff, and I had to do a lot of research. So during that time, I went to work for the dialysis center, which I really do. I work for the computer now. I worked for the computer now for a year, and I made my anniversary for working with them.
Congratulations.
And I actually, my patients are the same ones that I seen when I came in and said I was too young. Now they are my patients, and I'm helping them. A lot of my patients,
Wow.
that worked up, PE and stuff like that going on. It's just like they say like I'm a big influence to them because they got a chance to see, oh man, I used to be way smarter than this. I look like something was wrong with me, but I brought me through, and thanks to God, she gave me the I'm going ever since, man. I haven't turned around yet. My kids love me. They really like it more than anything. Oh man, I did. I get a chance to see him go through this. And the funny part about it is, before I went through, I did just had a kid.
Wow.
Yes.
With a lot of stuff that coming out to when it comes out of the kitchen stuff is real personal for me. It's not one of those things where people say, "Oh, it's something that we can learn about." Wipe it off. It's not just like it's real personal. I love getting up in the morning, 3:30 in the morning. My girl tell you, 1 o'clock get up is 3:30. I'm up. I'm up. I'm ready to go to work. I'm ready to, help my patient. Even though it's mentally and physically tired, because a lot of people don't see the work that you have to do.
Absolutely.
But it's real tiresome. But any kind of questions people may have, I ask them. I can refer them to certain different things. But I done been through everything. Like some of them, they don't want to talk to you because if you know dialysis, you can tell another person that's on dialysis how they feel. But if you've never been there before, you can't really tell them how they feel. And they'll come in and they're like, I had a rough night. And I talk to them like, hey, the problem was you seeing things in your sleep. So like I said, man, I done been there. I know exactly how you feel. I said, I'll tell you how you get rid of it. I'll tell you how you can go to sleep at night and all that stuff. And I had to coach a lot of people through that, but I'm doing it.
Man, God bless you, bro.
Technician. Excellent.
Right, and I want to go. They try to get me to be a dialysis nurse.
Oh man, yeah, you need to.
Go for it. Be a thing now.
Yeah.
I ain't mad at you. Come on here.
Yeah, I'm trying to. Like I said, I love it. I'm sorry that it had to happen like that, but like I said, everything happened for a reason. Because I was in the plant, I was doing good, but
right.
I think something for me enough to do so, man.
So Alvin, let me ask you. You live in Baton Rouge.
Correct.
Okay. How bad is kidney disease in Baton Rouge and the surrounding areas?
Horrible. Because my main concern that I have now when it comes down to kidney situation, man, is if you come, like you get yourself, you'll come in and come around for like coming the next day. Within a year of me being there, I think I have maybe lost about 10 patients. Because they don't want to come, and then you got the other people that like for instance, I can give for example, I have a church number, I'm not saying any names.
Sure.
I have a church number. They feel and hurt themselves and they have the situation going on, and I want to go talk to them in the hospital, and I believe I was doing that. I don't want to do it.
Yeah.
I haven't heard anything from them. I haven't seen them. I don't know.
Right.
What's going on, but only thing I can do is basically try to give them some kind of knowledge and let them know that, man, you can overcome it. I tell people, man, they got certain things called a lot of people don't know about it. Somebody else can have it. You have to cross that get the kidney that you need.
That's right.
Yeah. Let me ask you this, Alvin. Are there a lot of dialysis centers in Baton Rouge?
We have they call the
Sure.
those two now. Like other places, they have different centers, but those are the two main ones they have now.
Right. Are they around like fast food restaurants? Wow.
You just made him think about that, and he's like, you know what? They are
Right. Oh, you can eat. Okay, in the morning. What you think is great? Fast food.
Wow.
Like a lot of people, like I had to explain to them, like I teach as I learn. What you eat today doesn't mean you dialyze it out today. That's going to come into your next treatment. So what you eat today comes out your next, and what you ate that night, it comes out your next. You know, so you have to explain to them. But then, like a lot of people, they want coffee, they want water. I said, it doesn't make sense if you come in at 3 above your weight. And then I got to take off. I said, I got to give you 50, but take you off, and then I got to give you. When you walk out, if I give you a payout, I don't put something. I don't put a pound on you already.
Yes, say that, preach.
I don't put a pound on you already, and I can't do that. You know, they be mad at me. I don't care. I tell my, I said your life is more important. I'd rather you come Wednesday than seeing you Wednesday of next week in the box. It's just one thing.
Right. So
From the head, put it on out there.
right. So Alvin, let me ask you this. What has been the biggest change you've seen from being on dialysis and working as a tech? What do you know now as a tech that you didn't know as a patient? And that what should you think now, being on both sides of the fence, what patients should know as a patient in dialysis centers?
Dialysis is very important. Uh, I was never one that was not. I was complaining when someone said you can't eat that. I'm like, I don't want to eat on meat. Now, when I talk about Christmas, I told them, I was like that. I said, but guess what? I had to pay the price. So now I have my patients now. I teach them that if you don't want to pour too much on you, what you do is you monitor what you eat. You get those 50 ounces cups and get over to them and let them take that. I learned
Yes.
a lot of different stuff. I learned the backbone of it ready. So people come in and say, oh, my machine ain't ready. Why it ain't ready? Well, it's a backbone to why your machine is not ready. We gotta make it. I have learned that I have learned patience. A lot of that. A lot of
And so do you see the other, how can I put it? Do you see the other side now when patients, when they come and they ask why their machine not ready, or feel like you being rushed, like if a patient comes in and stand by and they're supposed to be sitting out in the lobby and they're standing. I mean, do you feel pressured to like get the machine ready more quicker or anything like that?
Yeah, anybody's on the outside, they know they have prescribed time that they're supposed to be there. They can probably get in there before the phone let you back at 11:30. I'm not letting you back at 10:30 when you walk in the door because I don't care if anybody's sitting in that chair. I don't care if nobody isn't sitting in that chair. You come into your correct time. We're convenient.
Wow.
Because when you start doing that, when somebody else is working your shift or somebody else is coming in and they see it, the other person. No, we like to have our team that we have. Our team is an old school team. I'm the youngest one in that team. And, they actually train me and taught me patience within the first 3 months of me being. And I appreciate it. Because it's like when I first got there, I'm like, oh, I feel like I got to do this on my own. It's a man.
Right.
A man giving somebody, oh, man, I got this on, help. But, they taught me. So, no, we don't do that pressure stuff like that. I don't know that.
Oh man, that's awesome.
Yeah, that stops up. That stops a lot of
A system. You got a system. I mean, when I was on dialysis, sometimes they had favoritism. Sometimes when I was on dialysis, because I was an advocate, they said, you're only this amount of time. So and so go ahead of you. So sometimes I had to switch, being respectful, or I had to change my time. They wanted to go on the trip. If I wasn't going anywhere, sometimes they switch like that too. But
Wow.
I don't. We don't. So we didn't have. I didn't have paper.
All right.
We used to hear that all the time.
Go ahead.
Yeah.
make sure everything is done correctly. It's not a such thing as a rush. When you come to deal with it, you deal with it. And that's one thing, when I was on dialysis, people didn't rush for me, so I'm not going to rush for my ass and make a mistake. I'm not to make a mistake.
Excellent.
Man, that's awesome, bro.
That's first thing conscience, and I don't want that on my conscience.
Right.
Yeah.
Wow. How long did it take for your mom to give you that transplant, that whole process?
The whole process, because I cut some of it out, man, because it's really heartfelt for me. So I didn't want to be out here like, oh man, that dude, he crying, what he crying for? Man, it's
Go on, I got some tissue. Go ahead, yeah.
it took a while. The reason why, because I was gonna be the first one in Louisiana to do the robot. But they didn't do it on me because I ended up getting an infection. So when I got an infection, I'll tell you when I got out the machine and went to help people with the flood. They didn't do it, so it pushed me back. Now, I had 3 setbacks the whole time. So because I was dialysis for 2.5. So I had through that whole time I had 3 setbacks. So if I didn't have a setback, I probably would have been on it for a year. Like I said, stuff happened, and it only took about maybe 6 months to get worked up because they were like, gotta lose weight. She didn't have to lose that much, but she had to lose like 10 pounds, so she lost 10 pounds. We had to get everything together for a caregiver because during that time I was married. My caregiver decided that they wanted to do their own thing, so we got divorced. So I had to follow through on that. That's why when you said somebody that what the relationship and all that, somebody did that, I come in and say that's that was one of the reasons why. I can relate to that point too. After that caregiver and everything like that, then I was fine. So wow.
That's not easy to find a good caregiver. My husband was a good caregiver.
Right.
And he was a match for me for a kidney, but I didn't get to take his kidney. He died of colon cancer. And I didn't remember to take it after the fact. But you know what I mean? So when I got the transplant, they didn't want to send me home because I had nobody home. Because I'm used to having him or my sister, and she had passed away too. So it was very hard. I didn't want a home attendant, but I see why I needed one, and I had to have one for a while. And I struggled through the apartment doing some things myself. So I'm glad that you had sense enough to get another caregiver. Everybody don't know that. So I ain't mad at you. You better go ahead.
And so, Alvin, how did that conversation look like? Did your mom come to you and say she was going to give you a transplant, or you asked her?
I didn't ask her that. The doctor said I had a kidney. I'm asked.
Wow. Without hesitation. Without hesitation.
Yep, no hesitation. Same thing my sister gave my dad. No hesitation or nothing. Just tell me I give my dad a kidney and she did.
Wow. That's beautiful.
It is.
Family. That's real family.
I mean, yeah, you said it, Lisa. I was just going to say, because you have a lot of people who family members may be scared or don't step up to the plate like that, man.
Or something that happens is when they come to the center, they like, oh, my aunt's going to give me a kidney, my cousin's going to give me a kidney. And then a year later, they're quiet about that. Like, what happened? I'm like, about it. I'm like, wow, so, that's how I put you in the beginning, not to get your hopes up for them to expect the transplant.
Yeah.
I got a friend like that too right now. He called me and his wife had to have a kidney. Transplant.
Oh my God.
It's to the point now that like everybody that tries to do it for her, they fall too. They get worked up and
That's true. That's true. I had co-workers that told me that too. 3 of them went to get tested, but they never made it to the test. So I asked them, but I felt in my heart they really were scared or wasn't ready. I let them off the hook gently. You know what I mean?
Right.
I was trying to say that. Just say it. I can live with it.
Right. Sometimes I think they're scared that if theirs was to fail because they had one, and if it was to fail, then
Tamika, this is just really ridiculous. What I mean by that is it seems like now everybody knows somebody with kidney problems. And it never been that way, Tamika. You know, in the 90s, in the early 2000s. I mean, now it's like it's almost like a normal conversation. What does that say?
Yeah, it's on the rise.
Right, it's on the rise.
It's been on the rise. It's
Epidemic.
Like, it's an epidemic.
And the crazy part is it's a lot of African American and Hispanic that's on it too.
Right.
True.
Hey,
That's true.
Alvin, you had mentioned the flood. So when it did flood in Baton Rouge, and you said you got out the machine to help, were a lot of clinics affected in patients when flood came through there?
Yeah, there was a lot of patients, a lot of clinics. Like I was on my PD at home, so it didn't affect.
And see, that's why it's important to do PD, right?
Right. I try to give you PD has its ups and downs. They have its ups and downs, but on the down part of it is like you do while you sleep. You know, 8 hours. It depends on your prescribed time. I ain't got to the point where I was on the PD.
Mm-hmm.
But when I go to a hotel, all I had to do is buy my own sheets, bring my shower head up, clean the room, and bring my machine. I call it back to the back on that just hotel, and they bring my stuff down.
Wait a minute, you mentioned change the shower head. I never heard of that. I mean, I heard one about someone on our show said they do it at home, but I never heard that changing the shower head at a hotel.
You don't know who took the shower before you leave. And when you look at the shower head, you ever look at all the calcium?
Right.
You done your investigation.
Right. You know, hotel one. So I took my own shower head. I bought me a fresh shower head. I had put clean to the hotel. That's what I do. I take their sheets. I tell them take your sheets off the bed, and I bring my own sheets.
Oh wow!
I love that dedication. I ain't mad at you. I was trying to keep my kitten. Y'all called it Hannah, gave it a name. All the doctors call it Hannah. And I took any restaurant I go to, I let everybody know we got to keep it.
Right.
So when she thought I had a kidney transplant, I come to the house and the house smelled like stuff. I gotta make sure you all right. I gotta make sure you're gonna be all right. Gotta make sure everything all right with you.
Man, that's awesome that she's thinking about you in that way.
Make sure you got the mask on because when I first got out of the hospital, like when I got out of the hospital and they laid around, I was gone. I was gone. I was in my hospital room for a month. I'm walking to different kind of medicine. I ordered me a remote control cold plate up and down the hallway. I went out by the pool with my mask on. And everywhere I went, I had a mask on. People knew me from in New Orleans.
I know that's right. Yes.
When I came to St. Louis, I ended up liking home decorating stuff. So if they're home goods, Tuesday morning and stuff like that, don't even do me. When he come in the store with a mask on, we ain't gonna bother. That's why I had a mask on. You know,
Yes.
and that was 3 weeks or so. I came back home to get a haircut. I was like, I gotta get my haircut. I came home, got a haircut.
I know that's right. Yes.
But
Wow.
I kept moving. That's a good thing about it, though.
That mask is important.
I mean,
I'm a social worker. The kids start coughing at work. I had a mask on or I refused to go in that room. I was talking from in there. How y'all doing? What's going on in there? Doing my sign language thing. You know, talk to me over there. You know.
Mm-hmm.
So our word though is they get nail from and put it in their nose with cut with Q-tip. Just put like right in the end part of your nose. And nail starting to hit that.
Wow, you done done your homework, man.
Right? You on fire, brother.
Yeah, don't look at just go and listen to your doctor. Do your research on the stuff that he tell you. Don't go in and do your own research because you look at anything under the living in your last days. You know, people started doing, they started thinking about to die. I read that, I was messed up for about a good 4 days. Oh man, I'm about to die. Yeah, I said, this ain't for me. Don't need to get this done.
Right. Was there ever a time when your mom was going through this process to give you a kidney transplant that you thought in the back of your mind that it wasn't going to take place or something may happen?
At one time because my dad was my role model. My dad was my role model. That's why I wasn't scared. A lot of people are scared. And I told my dad, I said, man, look, I'm sorry that it had to happen to you. But really and truly, I'm glad that you did because you're my role model to help me get through this. Because if it wasn't because of you, I probably would have been sitting down, oh man, this is not gonna work. Yeah. And I'm not a negative type person. I give everything credit first. And if it don't happen, then it don't happen. I don't dwell on it. But you know, I knew it was gonna happen.
Yeah, right, man. I love your attitude.
Yeah. Yes. You felt that in your heart, didn't you?
Oh yes, ma'am. Yes, ma'am.
You felt, I know you did. I know you did. You know, I mean, because they kept telling me, you know, we gotta check this, Lisa, we gotta check that. And I kept saying, we ain't paying her alone. She's working. As soon as you put her in, she's gonna work. You feel that in your heart. And I ain't never had a problem with it in the 3 years I had her. So I know you feel that. I see it in your eyes. I ain't mad at you. Come on now. Come on, that's beautiful, man. That's beautiful.
So, Alvin, you're not on Facebook that much, are you?
No, I'm not on Facebook that much. I try to stay low. I do a lot of groups on Facebook. Like they have like those things on Facebook. I do a lot of those.
Okay.
But mainly, man, I'm at work and I come home, take care of my kids, and that's about it. I'm just ready. I'm ready to go to sleep.
Yeah, we're not going to hold you because I know you got to get up early. Tamika, how did you meet Alvin?
When I had put a post up talking about the Zoom
Okay.
relationships and dating, and that's when he had inbox. Okay, that's a good topic, and we started talking through it.
Yeah, we would love to have you back on, man, because I love your, your attitude and how you look at things. And let me ask you this: you mentioned back in the beginning when you came on that you knew when patients can't sleep at night, you knew how they can go to sleep. How if someone was watching this now and is having trouble because a lot of patients have problem with insomnia, what did you use to help you get through that?
I went to the store and just clown around with my sister. Me and my sister always clown around in different stores trying to try something. They went to bed and bath beyond, and they had a spray that's called sleep with a blue bottle. And they say you spray it on your pillow and you spray it on your spray on. They say spray it on your pillow. I sprayed it all over. So I sprayed it on my pillow. So I didn't think it worked. My little at the time, my son was thinking about. So I tried it on him. I said, I'm spraying it on the bed, on the pillow. I sprayed it on the pillow as soon as he got in the bed. So I thought it was me.
Oh, right, like a placebo.
A placebo.
Yeah, no.
and you're reaching somebody that already know you've been there. That's what makes you effective. Besides God in your life, but I'm telling you, that's what makes you effective. And that's just beautiful. It takes teamwork to make the dream work. You go ahead now.
Yeah,
Go ahead.
yeah. You got some good information. Wow.
37 years old and doing that.
Wow. All right, let me get Tamika back up here.
Your energy in there for the patient.
Yeah. Wisdom.
Wisdom and the fact that you would be able to do the same place you were there and look at you now. So with you being in their shoes, it's different. It's so different. You can help them in ways that me as a tech, I can't.
Right.
I can't. So I'm sitting up here taking all your tips. So if I can go back to work and be like, hey, you can't see, you ain't gonna land it, but it's gonna land about it. Bring it back. Yeah, it's tough though.
Yeah.
So like Mr. Said, you are a hero.
Yeah, yeah.
Appreciate
You are a hero.
it. Appreciate it. Yeah, like I said about it, it's day by day. I go to church and the thing about it though, my nephrologist is who I work for. So it's like,
Wow.
you know, and I just feel like this ain't going right. That's how I was.
Wow.
I work like you stuff.
Well, it's ironic that you say that because I work, for my kidney doctor. He was one of the physicians that he still does care for me, but I did work under him as well. So wow. Um,
I volunteered with mine, but I worked for my husband's doctor.
oh, Dr. Smith.
Yeah.
Oh, okay. Well, hey, so hey, Alvin, we have other shows as well on this network that center around kidney disease, but in different perspectives. And we definitely would like to, as I say, make the round, bring you on and share. Because, today you shared about, your transplant and some shed light on working in dialysis, but we may want to bring you back on another show and talk from a dialysis technician perspective. I did dialysis for 33 years as a nurse, and I got injured last year with the Vita. And I'm not going to bash them on here because you work with them. It's not. I don't. It's not the. Well, no, but it's not the people like me, you, Tamika, who are on the front lines of this thing. It's the people who we don't see that's way up that make, you know, 10 million, $20 million a year. And we down here trying to scratch for a 5 or 10 cent raise and can't even get that, but they add more duties to our workday.
Every job.
It's almost like trying to squeeze blood out of a turnip. It's always something extra they want you to do to try to reduce the productivity. Yeah. So, Alvin, I mean, before we close out the show, what words of wisdom or encouragement could you leave with someone watching this show that, you know, same age as you, younger, a few years older than you, that is dealing with this disease or it's in their immediate future? What could you tell them and how to cope with this?
I can tell them, anybody think, don't give up. Don't listen to the negative and always be positive. Always be positive. It's easier for you to go going to the next side, anytime. I think for energy to be positive. I think about that. Which one do I want to burn most of?
Yeah.
That's the way.
Short and sweet.
Right. Right.
I know that's right.
So you in Baton Rouge? What's the closest airport? Mm-hmm.
I went to California for academy.
Oh yeah, they already send people out there to the academy. Oh, right. Was Kent Theory at that meeting? he no, he's the president. The one with he always wear the Three Musketeers stuff. Wow.
They understood, and I like working for the company. It made me. I'm never when I left from it. I like working for the company more because I started seeing the real backbone.
Damn.
I told myself I want to touch all sides. I want to do bio. I want to do RN. I want to be one of those when they say, "Man, we need somebody on the floor." Okay, I can do the floor right quick. I'm bio, but I jump on the floor.
Yeah.
I need somebody to do assessment. I do assessment right quick.
Wow, flexible.
Right, but let me just say this, man. That's very admirable of you to want to do that. But I don't think it's going to work out like that. Far as bio and I mean, you can probably train, but you would probably have to work for two different companies. Because DaVita is not going to see the biomedical technical department is separate from clinical services. So if you become a biomed tech, you may cover like three or four different other units. I don't know how. I know this is how they do it here in Baltimore. So you just don't have that one unit. You're going to have a couple of other ones. That's how they get their money's worth. Yeah, and there's no way you can do that, bro. I mean, unless on your days off, and then go to. Yeah, and that's all she want to do. She ain't gonna do no patient care. you know, wow, man. But yeah, man. Let me just from what I hear you say, and how long you been doing it? Yeah, yeah. All I can say, man, is definitely keep going. I remember when I first started in '85. All you know, take advantage of all the services or benefits that they offer. You go to school, take the 401k. I mean, pimp them for any and everything you can, that you could get from them, and use this that's going to help elevate you to a different level. Do it, man. I mean, even with that RN, because if you get your nursing, that's just another stepping stone. If you stay there, you can go and get your master's or do something different. It doesn't have to be right there with the Vita. I mean, there's people that work 20 years, and there's nothing wrong with that, but it just gives you a stepping stone to bigger things.
Wow.
So I definitely tip my hat off with you. You don't see a lot of brothers doing dialysis. It's a field that's dominated by women. We all know that. I've all my supervisors, except maybe one or two, were women, and we're the minority in this field.
Right. We got two. Where we have, where if I include New Orleans, we have four male technicians. We have one nurse.
You talk about in just your clinic or around?
Just my clinic, just like Louisiana area, is me and the other guys are travel nurses. They don't have to.
You know, only black male tech.
In Baton Rouge.
Wow.
Right. Right. So when I go to different clinics, sometimes I travel, and I go to different clinics. Yeah. So and a lot of, and let me be honest with you, when I first started, a lot of my thought that might be on the other side of the fence. No, I ain't on the other side of the fence. I would have to be on the other side of the fence to do this. No, look, I have a girlfriend, I have kids, I have a child on the way. You know, and
All right now.
Congratulations.
Yeah, congratulations, man.
So
Wow.
when you work in dialysis, you have to be on the other side of the
well, that's what they think, you know, but those are that I think that have a short term of thinking process.
Yeah.
That's what I'm with that.
All right.
Yeah,
Wow.
it's a short term thinking process. People ain't only limited. Oh, women can't work in the plant. They don't want to work in the plant. So why I can't work in the medical field?
Yeah. No, and that's true. Tamika, when I traveled as a nurse and I went to North Carolina back in 1999, and I worked at a unit in Sanford, North Carolina. When I walked in and I was doing assessments, I mean, I had patients ask me, was I the tech? And I was like, no, I'm the nurse. And then even doing assessments, a lot of the black patients, were like, I'm proud of you and congratulated me because I guess they never saw a black male nurse down in that area in a dialysis unit.
Wow. Rare.
Yeah, yeah. So, do they have any dialysis schools in Baton Rouge?
They got
Well, other than the Vita, some places have independent schools, like trade schools that do this, and then they send the person to the Vita to apply. They normally charge, right? But no, but up here north, there's places where they do dialysis training and charge people up to 1,500. And a lot of people don't know if they apply to the Vita, they get paid while they're training. But I guess they use that to come in with some type of training. But nowadays, the Vita just hire you right off the street.
right. I didn't have those. Nobody. I don't think people. I never thinking about it. You know, and I learned all that. I learned how to speak. Everything it is, I have learned from the people. Wow. And now, like my patients, I got patients. My girlfriend, like, because I just finished taking her. My girlfriend had took well done. My patient walked to the doctor and a man walked to the door.
Wow. How Tamika, how rare is that?
Right. So it is.
Damn.
Yep.
Baton Rouge got some saving up going on over there, huh?
Yeah.
Wow.
They do.
Wow.
I mean, how many opportunity like that where your girlfriend or boyfriend, something's going on, and the person that comes in the door and you call the EMS is a person that your spouse treated treated at the clinic. That just shows you how prevalent this disease is. So
And the thing is, I say, remember the first time I stuck and she was teaching me, I said, that's what.
yeah. Wow. Yeah. We got to bring you back on. I got to get your number from Tamika so I can keep in cut contact with you.
Yeah, that's cool. I'm gonna shoot my number. I'm going to work and probably whatever y'all have something. I will be on here.
No, we're going to get you on. We have another show on Wednesdays called The Warrior's Quest with Jared A. Brown. And that show, we bring on kidney warriors who are looking for a live donor, and we give them the hour to share their story while Jared interview them on their quest to find a kidney. And we put their information up on the screen, the hospital, their blood type. And, if anybody sees the broadcast and they want to donate, they can, call it. It just gives them another option to try to find a organ donor. And, yeah, and what we do at times on Jared's show, we bring on co-hosts, guest co-hosts to co-host the show with them. So you would be on and share a little bit about your story, and then the person that we bring on for the show, they'll go on with the show and Jared will interview, and then you have chance to, you know, dialogue with the conversation as well and ask questions. So it's like a learning experience, education at the same time, giving a person an opportunity to find a donor. We never know. Somebody could be watching the show that may think about donating and they see this and maybe they will. It's just another, like I say, another option we hope that can reach and also spread kidney disease awareness and organ donation awareness.
Do y'all have a lot of kidney walks out there?
Yeah, they do kidney walks. We don't have our own, and I don't participate with Kidney Foundation.
In New York, yes. I go on several. I go on the colon cancer walk for my husband, the kidney polycystic kidney, because that's what my family and I was struck with, survivors, and the regular kidney walk. So I will raise money or donate money, or I'll just do the walk or donate whatever I got and whatever I'm able to do. I use it.
Absolutely, yeah, yeah. So
They have a little bit of kidney walk out here. We have it. I believe it should be bigger. To be honest with you. National Kidney Foundation is the one that threw it. I think National Kidney Foundation. Us being down south, we need a lot of knowledge down here, and I can't reach everybody.
no, hey, that's what I was about to say. I didn't. That's a whole nother show. But but Alvin, let me just say this, and I'm speaking from the heart. If you ever want to do something down there, like raise awareness, we'll come down or I'll come down. I was going around the different states to try to raise awareness, and I had a little hiccup along the way. But if you ever, I mean, even this fall, I mean, we'll fly down there, and if it's a place or a library where we can hold an event and we can, you can get people to show up or whenever we can do a show from there like we normally do. And hey, man, because that's what we're about. We got to go around and raise awareness because there's there's so many clinics popping up here in Baltimore, huh?
I think because I'm a home ambassador for our clinic, so it's for me to actually tell them.
Excellent. Wow. And that's what I'm talking about. I was an advocate on mine. Go on, ambassador.
Right, right. All right, man. Well, we'll definitely keep in touch with you. Yeah, yeah. I'm gonna get your number from Tamika and reach out to you.
Thank you very much.
I may want to bring you on in September on another show we do on Sunday mornings called Sunday Morning Transplant Coffee Talk. Yeah. All right, well, thanks for coming on the show. We really enjoyed the time having you on, man. And anybody you want to say hello to or give a shout out to? No, it won't. It won't. It won't, man. And thank for taking the time coming on. And you got to go to work tomorrow? Yeah, yeah, man. I'm gonna let you go. Oh, what time is it there? Oh, what time is it there? Oh, okay. Okay, an hour behind. All right, man. Well, we ain't gonna keep you, man. Get some rest, man. Stay blessed and encouraged. And thanks for coming on, man. I know you're gonna be a great tech, man. Even though with this 1 year, I mean, it seemed like you have more years than what you have under your belt with this knowledge and how you getting this information, man.
Phenomenal. You know what, Steve? I think he knows that extra because we value
Money driven. Yeah, man. Well, we definitely bring you back on and welcome to the family, man, because we're going to, you know, a lot of technicians, bro, don't like to come on and talk about dialysis because we talk more than just, kidney disease. We get into the treatment and, being mindfulness and having patients know like what your blood flow rate is, what size needles you're on, what type dialysis. Matter of fact, I did a show the other night. Here go a 15 gauge needle. Yeah, this is 1 1/4. Yep. So, I mean, there's a lot that people don't know when it comes to access care and people getting multiple access and the doctors, doing all these surgeries when some of them may not even be necessary. Right. So, like I said, that's a whole new show that man, we could go on and on. But man, huh? Right. Wow. Yeah. Yeah. I've had stories like that with people, doctor took them off dialysis, because of maybe acute kidney injury or something like that. Wow. Mm-hmm. Yeah, see, that's the education is missing. Wow. Oh, one more thing before I let you go. If you could share this station with your patients, if you can share our Facebook page, Urban Health Outreach Media, we have multiple videos under the video sections on education, different shows that would be very helpful and useful to, I believe, the patients down at your clinic and Baton Rouge and anywhere else. But we just gotta let them know that the information is here. So we can get one, Tamika.
Okay, all right now. That's what I'm talking about. Come on.
Okay.
Because I research myself, I just on this doing t-shirts and stuff like that. I kind of have my own brand. I don't push.
Oh man, that's awesome. That's awesome, man. You're supposed to. Now that being said, I could just send you the what is it, Tamika? The file for the um for the logo, and you can print your own shirt. Oh, okay. What's your email? I want to get your email right now. Do you mind giving it to me on air, or you want to send it to me through Messenger? Sure. Sure. Tamika, get that email. Tamika, get that email for me. Oh, yeah, send it to Tamika during the phone after the broadcast, and she'll forward to me.
Excellent.
Yeah. Oh, excellent, man. I appreciate that. And we might have to get with you on some T-shirt deals. You know. No, that's just a resource. That's we got to have resources in this fight on kidney disease.
Somebody was fighting me today because I was trying to get a shirt. I always make different. I used to have my show before. I was something, enlighten people, and they didn't want to make it if it ain't a several shirts. I told them I don't care how much I gotta pay. I'll get my shirt. I want. And then if it's full right, I can always get more or sell or block. But right now, let's do it.
Yeah.
But that's all good.
All right, Tamika, just send Tamika that email address as soon as we get off. All right.
Okay.
All right, I appreciate that, Alvin. Thanks a lot for coming on, and we'll definitely be in touch with you. All right, man. Take care. All right, man. God bless. Take care. All right. Yeah, that was a great show. Lisa, we definitely appreciate you coming on as well to talk about conservative therapy of what we talked about and joining in on the discussion tonight with Alvin Myers. Thank you for your time.
Oh, you're welcome. Thank you. I was laughing because whatever they gave me, I was going to told me my sister was laughing. Taking your clothes up. I said I was. And I had everything on back. Was like trying to I made it good. So thanks, guys.
All right, Lisa, we be talking to you soon. Ladies and gentlemen, Lisa Baxter, the Lisa Baxter Show. All right, Lisa Baxter, the Lisa Baxter Show. Watch her 8 to 8:30 p.m. Eastern Standard Time every Sunday. Thanks again, Lisa. All right, bye-bye. Hey, Tamika, you found a good this guy Alvin Myers. I mean, answered your ad, saw your ad. That was a great conversation with him. Great attitude. Oh yeah. Mm-hmm.
You don't know what I'm going through. He can help ease them through the process versus me. He has a better way of going through. So though I understand from a parent view,
Mm-hmm. He is. He is.
So he can help educate on a whole nother level. We can't touch on study next year.
You're right. You're right. You're right.
So I really do see about
Okay.
but I think make a work and tell my patients
Yeah.
and something that they always complain about sleep. They always so tired. But what can they do? The doctor
Yeah. And we don't know. And honestly, even though we trust and take medicine, I mean, I take a blood pressure pill. I'm not going to lie. But even though we don't know the after effects that is what's really going on inside our body after we take these drugs over a long period of time.
right. And then like they do something all natural versus another medication. That is excellent. That's one that's toxic going into your body.
Hmm. Yeah, I already can see your wheels turning in your eyes. Right. But no, you're right. You're right. I mean, that's why we need to do these shows to hear different experiences, what people are using. And then one good thing I want to say about this story that I like, his mom gave him a kidney and his dad gave his sister or his sister gave his dad a kidney. Wow. All in the family.
No, they were supposed to share with one another. Mom probably wasn't imagining mom was imagining worked out perfectly. They crossed that. Amazing.
Oh, so that's why he was talking about the shared pair because they did it between them.
I'm not sure. I'm not
Oh,
sure
okay.
when.
Yeah.
Awesome. So his story of having a transplant and going back to work. How does having a transplant going back to work? How did he get there? Because a lot of patients that has transplants have not been able to go back to work.
It I know Tamika. A
Because of
lot.
reasons and stuff like that. So I don't think another vessel is like, hey, this is how I do it. Try it this way. He's so positive. He's trained them 17 different ways.
And not only that, but people look, you can go to dialysis if you get a transplant and that's something that you think you can make a difference or give back in someone else's life. DaVita has the Star Learning Program. They will hire pretty much practically anyone. I mean, I don't say that in a demeaning way. They hired Alvin. He didn't have any experience, as he said, other than him being a patient. And they taught him, and he caught on. And and even what's Kendra Tanner, who was on my show Sunday, same thing. She had a transplant and she became a dialysis tech, and she's been same length of time, Tamika, about a year. She's been doing it, same length of time as Alvin. So I see that possibly being a trend for a positive trend for some transplant warriors who get that transplant. That's another option to try to get a job at the dialysis center. I mean, however, let me just forewarn you. Yeah, huh? Yeah, that's what I was about to say. I was going to forewarn you. It's not for everyone, and it's a lot of standing on your feet, a lot of long hours, and the work is demanding, as Alvin said, very mentally and physically demanding.
Right. And you know what? It's like when I come home from work, I'm mentally. So,
Sure, and I could definitely relate to that.
I'm mentally tired or whatever. It's the mental.
The mental aspect, yeah. Yeah, and Tamika, I mean, I can honestly understand how you feel because me, when I was working and by being a charge nurse, I was getting pulled from every different direction. When I walked through the clinic, I may have one patient call me, then another patient, and then I may have a staff member that may have a problem. And so you don't really get any time to yourself when you're at the clinic. And the only time you get sometimes is when you come home. But if you have a family, you got to spend time with the family. So it is for me, I live by myself, so I can kind of decompress. But it hasn't always been like that. But that's the type of things that we go through as caregivers when we're working in this field.
Yeah, I'm extremely tired. I go to work at 4:30. I come home about 3:30, and I need to go to sleep. I need to recharge, and I don't wake back up until 6 o'clock
Yeah,
to recharge. But how do you do that with the 8 month old? It's difficult. Thank God I had some help.
yeah,
But the mental drain, I think, is worse than the physical drain.
yeah. So, and healthcare givers working in dialysis definitely have to recognize that. And a lot of patients don't see or understand when they see staff working at different places. You got to think about those long hours, and these same people are working on you. And if they haven't gotten any sleep, there is room for error. If one is not paying attention and realizing that they're tired, and so well, Tamika, I see you over there yawning. You making me yawn.
I'm sorry, because I was at work.
Oh yeah, no, absolutely. And you got to work tomorrow. Oh, great, great.
2 p.m. as needed, not every day. No, no, no. They were never do it like that.
Oh, absolutely.
But being with my children, I'm good. I'll make it work.
All right, all right, Tamika. Well, watch my show tomorrow. I'm gonna have on Janaea Robinson. Janaea, if I pronounce your name wrong, last name wrong, I'm sorry, but I worked with her, and she's a kidney warrior now. She worked in dialysis, so she's on the opposite side of the fence now. She's undergoing kidney dialysis, been doing dialysis 10 years, no longer does it anymore. She's worked, in another field, I believe, but she had lupus. And the one thing, she was proactive because before her kidneys failed, she wanted to be a dialysis technician so she could kind of see what to expect and get that experience as a technician, and then when her kidneys fail, she would know how to approach her disease.
Right. Awesome.
So
Good to see that.
you got many people doing this many different ways, but the thing is, the key is education and awareness. If you don't know any of this stuff before going in, it's going to be overwhelming. Uh, you won't have any time to make any other decisions or options because you won't know. You'd be so overwhelmed on what you're going to do about your newfound diagnosis.
Yes, like the education and awareness. Oh my gosh. So important.
Yeah, and we're going to be on the forefront and getting this out there.
Yeah.
Yeah. All right, Tamika. Well, I'm going to, we close this show out. It was a great show. I enjoyed the guests. I really did. You really came through. You be coming through. Don't worry about dialysis spa and all that, but because the past guests that you have brought on have been, you know, awesome.
Thank you.
Yeah. So, all right, guys. Until next time. Thanks for watching Urban Renal Talk with Tamika. Oh.
MC.
Yeah. I just thought about that. I was waiting for you to say Steve.
Thank you for watching.
All right. Thanks, guys, for watching Kidney Matters. We enjoyed the show, and tune in tomorrow for kidney disease education moment. Good night, guys. See you, Tamika. Guys, thanks for watching YouTube. If you do watch this show, thanks. We appreciate you tuning in. God bless you. Another episode of Urban Renal Talk with Tamika and Steve is in the books. Peace. Oh, and don't forget to share our YouTube channel, Urban Health Outreach Media. God bless.